In 1978, my grandfather, Dr. Howard DeBossi Giles, passed away, leaving behind a library of more than 200 medical books. I was very young, so I never really got to know him. Today, I'm opening one of those books to try to discover a little more about the man who owned it. I'm Lisa, and this is Finding Dr. Giles. This is book number 2, The Origin and Treatment of Stammering by George Andrew Lewis, published in 1910. It is a softcover, paperback, and the front cover is loose, but it is present and it is otherwise intact. This was apparently self-published, and when I did a quick Google search, it came up as it's considered quack medicine. This book falls into the historical categories of quack medicine, mental health history, and early speech-language pathology. The author, George Andrew Lewis, was a legendary figure in this niche. He founded the famous Lewis Phonometric Institute and School for Stammerers in Detroit. He was known for highly psychological, almost flamboyant methods to cure, quote-unquote, speech defects, and his institute even won a gold medal at the 1904 St. Louis World's Fair. This is an 8th edition, enlarged and revised. This was self-promotional text, and it was apparently aimed to recruit students to attend his school, and contains psychological theories, patient testimonies, some very interesting illustrations that I'll show you here in a second. According to my Google search, this would be something that a collector of weird history might be interested in. There otherwise isn't a lot found online about Mr. Lewis. He starts off with a section called The Author's Experience. The earliest recollection of my difficulty carries me back to my infancy. I can well remember my mother taking me to school for the first time, and with tearful eyes, she told the teacher not to chastise me if I stammered because, said she, he cannot help it. From that time until my cure, I cannot remember a period in my life when I did not labor to much disadvantage because of my impediment. But he talks about the difference between stuttering and stammering, which I'm not sure I know what that is, so let's take a look. Here is an anatomical view of the speaking organs, an illustration. So this makes me wonder if my grandfather had any cases of stuttering or stammering that he treated. A number of English and American writers use the terms stuttering and stammering synonymously. Dr. Klenke draws the parallel as follows. The stutterer immediately begins to stutter violently when he is observed and shows a spasmodic fear and apprehension. He exhibits an agitation of his respiratory organs and congestion of the blood in the chest and head, which is increased in proportion to his efforts to overcome his difficulty, and there appears a convulsive action of the chest, throat, and head. And now stammering, on the other hand, the stammerer usually speaks better when he is observed and thus forced to pay attention to himself. He betrays his defect when careless in singing, declamation, and measured talking. He never exhibits an agitation of his respiratory and blood circulating organs. He does not have the least difficulty in the formation of his voice. He betrays his defect as much in loud talking as in whispering. Okay. Stammering, the inability under certain conditions to articulate or control the organs of speech, which are usually, under such circumstances, tightly held together, accompanied in many cases by the substitution of one sound for another. Stuttering, a defect in respiration and vocalization, oftentimes causing spasmodic action or the rapid repetition of one word or syllable before the following one can be uttered. Obstinate cases of stammering. Few persons understand how to correctly diagnose a case of stammering. In fact, so little is known of the disease except by a limited few who have made the subject their life study, that I doubt if any of my readers, physicians and teachers included, have ever attempted it. So he is the expert. There are some, here we go, here are the illustrations. There's a notation written in red, breathing explained. I'm not sure if that's my grandfather's handwriting or not. It's interesting how the printing is crooked on the page. It's not straight, and several pages are like that. That one, well, no, there's many pages that are kind of crooked. I wonder if that was perceived as a defect, if that made people think this guy was a quack. You can't even print a book straight. So here is figure 1, image of vocal apparatus as seen in a mirror held far back from the mouth. And this is supposed to be, we are able to see an image of the interior of the larynx. And then we have incorrect and correct thorax, upper thorax, and incorrect and correct shape of the throat. That seems involuntary. So this is correct chest, that's incorrect. This is correct throat, incorrect throat. I don't know about you, but I don't think I have a whole lot of control over that. I don't know if he's saying that, I mean, I guess he's saying if it's correctable, then it can be something you can control. Relations of the body and mind to stammering. Here's another, the practical treatment of stammering and stuttering. So he's got several books apparently. So here's the origin and treatment. And then there's the practical treatment of stammering and stuttering. This was $2.50. That seems like that would have been a lot of money back then for a book. And then he's got another one that's an advertisement. I don't want to open that too far because it's kind of stiff. And then another advertisement for a book, Home Cure for Stammering. That one's $3.50. So interesting book, and interesting now here in 2026 that it's considered quack medicine. And would be considered today as not a treatment, but a novelty, basically. Look at what people thought back then kind of book. So back then it was probably somewhere between $2.50 and $3.50. And in good condition, this might fetch $40 is what the internet is telling me. So that is book 2 out of more than 200 in my grandfather, Dr. Giles' collection of medical books. Let me know if you know anything about George Andrew Lewis. I'm very curious because there's not a lot other than what I've told you. There's not a lot of information, and other than the picture in this book, I couldn't find anything online. If discussing this book sparked a memory, or if you had any experience with being treated for stammering, especially by George Andrew Lewis's techniques, I'd love to hear from you. I would love to know if my grandfather ever tried to treat someone for stammering. Your stories and information may help preserve this important legacy. So would love to hear from you. Every book tells a story, and I'm just getting started.